Hi, I'm Franziska, a registered dietitian and certified diabetes educator who's passionate about low-carb living. In this video, I'm going to share how a low-carb diet can help people with diabetes and prediabetes improve their blood sugar control and their quality of life. Carbohydrates, fat, and protein are the three macronutrients, or macros, found in food. Of these, carbohydrates, or carbs, have the greatest impact on your blood sugar by far, especially if you have diabetes or prediabetes. There are two broad categories of carbohydrates that your body can digest and absorb: starches, which are long chains of sugar or glucose units linked together, and sugars, which are two different sugar units linked together, such as glucose and fructose, which makes sucrose, or common table sugar. Examples of starches include potatoes, bread, rice, and pasta. Foods rich in natural sugars include fruit and milk, while desserts and sweetened drinks are high in added sugars. During digestion, starches are broken down into glucose, and sugars are broken down into glucose and other individual sugar units. For instance, lactose, the sugar found in milk, is broken down into glucose and galactose. Once starches and sugars have been broken down into single sugar units, they're absorbed by your digestive tract and transported into the bloodstream, where glucose causes an immediate rise in blood sugar. This signals your pancreas to release insulin to help move the sugar from the blood into your cells. Normally, the insulin binds to a receptor on the cell. This allows glucose to move from the bloodstream into the cell before blood sugar gets too high. However, in people who have type 2 diabetes or prediabetes, blood glucose keeps rising because the cell doesn't respond properly to insulin's effects. This is known as insulin resistance. And in people with type 1 diabetes who don't produce insulin, blood glucose can't get into the cell unless insulin is injected. Exactly how much carbs raise blood sugar varies from person to person, even among those with diabetes or prediabetes. So it can be helpful to test your own blood sugar immediately before eating food with a known quantity of carbs, and then retest an hour later to see how this affects you. Healthy blood sugar levels are between 80 to 100 milligrams per deciliter before eating and less than 140 milligrams per deciliter after a meal. But ideally, your blood sugar shouldn't increase much more than 30 milligrams per deciliter after eating. Knowing how many carbs your own system can handle is key to achieving healthy blood sugar control at all times. This includes carbs from fruit and whole grains. Since carbs can have such a large impact on blood sugar, it's not surprising that low-carb diets are ideal for people with diabetes and prediabetes. Conventional diabetic diets are centered around moderate to high carb intake with deliberate restriction of calories, fat, or both. Low-carb diets help regulate blood sugar by changing your body's primary fuel source from sugar to fat without consciously restricting calories. With a low-carb approach, your blood sugar rises very little after eating before returning to its previous level within a couple of hours. So your blood sugar levels stay within a healthy, narrow range throughout the day with less medication, or potentially no medication at all. Several high-quality studies show that carb reduction can lead to dramatic decreases in blood sugar levels, along with helping you feel full and preventing hunger between meals. So what do you eat on a low-carb diet? Protein foods like meat, eggs, seafood, and edamame or tofu. Fermented dairy products like cheese and plain Greek yogurt. Non-starchy vegetables like leafy greens, broccoli, cucumbers, bell peppers, and many other vegetables that grow above the ground. Also, olives and avocados, which are technically fruits but often grouped with vegetables because they aren't sweet. And smaller amounts of nuts and seeds, and low-sugar fruits like berries. Most low-carb meals also include some added fat, such as butter or cream sauce on meat, fish, or vegetables, or a creamy or olive oil-based dressing on salad. Good beverage choices include water, of course, as well as coffee or tea with a little cream or milk. By eating nutritious low-carb foods, you can improve your blood sugar, minimize the need for medications, and decrease your risk for diabetes complications, all while feeling full and satisfied. Thanks for watching. If you like this video, be sure to subscribe, like, comment, and share. See you soon.